Sure.
Hi everyone, welcome back. Okay. Hi everyone, welcome back. Today we have the pleasure and honor to receive Dr. Javaid. Dr. Javaid, welcome and thank you for taking the time
Thank you.
to wake up so early to come to be with us.
Wouldn't be different if wasn't the case with this pandemic. I would already be in my clinic around the same time, so it doesn't make much difference. I'm up. I'm happy. I get a chance to talk about something I absolutely love, which is dentistry and how things are. Hopefully, things will improve. So, no problem.
So can you just introduce yourself so our audience know what you do and who you are?
So, my name is Dr. Mohammad Ahmad Javaid. Everybody here in Canada calls me Dr. Mo. I did my BDS, which is like DDS from Pakistan. Following completion of that, I did my primary fellowship from Pakistan, which is the training is recognized in England as well. And then I came to Canada to do my first master's at McGill Universities. Once I had done my master's at McGill University, then I did my second master's at the UBC. Following completion of that, I also did a diploma in periodontics, which is 3 years training residency in periodontics and implant surgery, which focuses on periodontics and implant surgery basically. Following completion of that, I did my fellowship of the Royal College of Dentists of Canada and also cleared the exam for the diplomat of the American Board of Periodontics. I also did additional training for the IB sedation at the University of Alberta. I have been involved in private practice for the last 3 years or so, focusing on periodontal and implant surgeries. I also love teaching. I had the opportunity to teach at the UBC during my residency, and I'm still involved part-time teaching at the University of Alberta in the capacity of clinical assistant professor. I've taught at the undergrad level, which is DMD DDS, and also at the residency level, which I absolutely love doing, which is basically periodontics residence at the University of Alberta.
Wow,
So
that
this is where I come from.
I'm gonna call you Dr. Mo. I think it's cooler, but something is
Absolutely,
wrong.
absolutely.
Something is wrong in your math. You look way too young to have done all of those things.
Oh no, it sounds way more awesome than it really is. It's nothing. I was lucky. I was supported by my family, and I'm blessed. I'm grateful. But no, it's nothing. It sounds way more awesome than it really is.
No.
And I'm afraid as you talk, when you get to know me, you'll be like, oh, it doesn't look that awesome. So no,
No, but mainly we're trying to have some fun here because we have to break the ice in this early morning. But
absolutely.
can you tell us how this crisis, the pandemic, has affected your practice personally?
So basically, right now, uh, things are completely shut. Pretty much. So I work in right now as we speak. I worked in different offices over the last 3 years. But right now, as we speak, I work in two major offices. One is in North Alberta. The other one is here in Regina, Saskatchewan. And pretty much the majority of offices, not just offices where I work, they're completely shut down. And the staff which was working, I feel for them. They have been laid off in a lot of offices. So in theory, we have what is the emergency treatment, and some people go there and whatnot, which is good because that reduces the burden from the hospitals. But in reality, things are almost uh, at a stage where everything is in terms of production, revenue, whatnot, from a dental industry point of view, everything is at a standstill.
You haven't been shut down for how long?
Uh, Pretty much, I would say for the last 2 weeks almost. Slowly, I would say after the first week, things started to go um, towards slowly closing down, shutting down. But by the mid to 20th of March, it came to a point where pretty much almost everything came to a standstill. And it's been like that for the last 10 days, I would say, if not more.
And how is your patient reacting to that?
So I was pleasantly surprised actually. I received probably 3 calls, I think, from my patients, and all they said was, Dr. Mo, we just wanted to make sure you're doing okay, and we just wanted to check up and see you're fine and whatnot. Like, it was really nice. I was not expecting my patients to give me a call and
Wow.
ask how I was doing. So that was amazing. That was absolutely amazing. And
A recognition
I,
of
I,
the work you're doing every day, yeah?
I don't know. No, I'm lucky. I think I'm fortunate. My patients are some of the best people. Um, it's a privilege to be involved in management of their oral health. I find myself very fortunate in that regard. But it was amazing. It was a very surreal feeling. And some patients, for example, I received a call from another patient where a guy asked me about sutures. But fortunately, I think in an individual's capacity, I've been lucky in that sense that fortunately I've not had issues. People who have called me have either asked if everything is good, you're doing okay, which was amazing in general, in my opinion. People in North Alberta, people in Regina, they're awesome people. So didn't have any issues with that sense. The other second good thing was from an office policy sense or an office policy perspective, I think our office did really well. We called in all the patients, we explained the situation, we gave the telephone numbers of the dentist. So as an office, I think we did really well, both here where I work in Regina and Alberta as well. Patients were happy, they understood the problem, and they're completely on board with this.
And you have two hats. That's your hat as a periodontist, but how about your hat as a teacher? How this crisis affect your work as a teacher, but also your students?
I feel for the students actually. I really feel because if you think about it, in a lot of programs, for example, if you're involved in a degree related to, let's say, education or public health, or let's say certain type of engineering as well, you can do a lot of stuff which is online, which is good, which is amazing. And you can do a lot of stuff in dentistry related to preclinical studies. But the reality is, if you're in a residency or if you're in a final year, you want to get in, you want to do your surgeries, you want to do your clinical work, you want to do your and whatnot. So this pretty much delays everything. And I do feel for the students because it's not just that we are almost like at a standstill. Reality is, realistically, even hopefully when we go back to things will not be normal, maybe for another 4 months, 3 months. So this may lead to a situation where things would be less than optimal from a student's perspective in terms of gaining experience and clinical skills for another 6, 7, 8 months, maybe. And that would be at best, I think. Anything less than that would be a jackpot. But that's very unfortunate. So I really feel for the students, and not just in that regard. Given my own experience, I came from another country. I came from Pakistan, and I lived here. The economic impact of a student, let's say, who's been supported by a family, which are doing all the best that they can to support their child, their or their revenue would be lost because of this pandemic. Then they have to send the money to the child, knowing fully that this short while, hopefully it's a short while, would be an extra burden because 5, 6, 7, 8 months would be needed extra for the student to graduate. So, in a lot of aspects, then the visa issues for a lot of students because uh, when you get the visa, for example, you've come to Canada or US, they give you a visa, let's say for 2 years, and you as a student are expecting, okay, I'll graduate in half year, but now because of this thing, may end up may need to renew the visa. And if you come from a certain country, then it's a very lengthy process. It's not an easy process. I've been through it, so I know it. So not just from graduation point, from logistics, from economic point of view, it's not optimal. I feel for this.
And now we're talking about the future, and I'm asking. Is that mean that the University of Edmonton has officially accepted the fact that some students will not graduate this year, or is just that we right now still not knowing, not sure what is coming?
Nobody, I think the reality is nobody's 100% certain at this stage. I'll give you an example. If you look at, let's take an example, a simple example. I was reading the news in the morning today. I was looking at the CNN as well. The unemployment in US is more than 6.6 million as we speak. Now, the economists, they were expecting the number to be around 3.5. So it's almost double that. Nobody expected that. I'll give you another number. So if you think about it, the number of cases, for example, in US were about 100,000, I think, March 27th. By March 30th, it was over 150,000, doubled in 3 days. So the point is, the way the and the worst part is that we are still not sure. We are actually, if you listen to a lot of people, they say we've still not peaked in North America, which is the scary thing. So right now, initially everybody was saying, okay, you know what, we'll be back in a month, 2 months. But right now, people are more skeptical. So everybody's just pulled the horses back, thinking we don't know. Hopefully, things will be normal or the new normal by June or July, worst case scenario, August. But nobody's really certain. Nobody's really certain.
Are the students still following classes online, or everything has been shut down?
Yes, online, yeah. For a lot of I know, I was talking with my colleague. She's the co-director, I think, I'm not mistaken, of the program, and we were talking about it. Yes, the university, not just the University of Alberta, a lot of universities, because I was checking out last night, they've taken the measures that they could, and they're doing the best thing that they possibly can, given the circumstances. But it's still going to be very difficult. It's going to be very challenging.
Let me take this opportunity to share with you what I discussed with Dr. Thomas Nguyen from Harvard. He has
Yes,
the
please.
same problem, and he's a periodontist too, so I think you will get along.
He's
But
my class fellow, actually. Thomas is my class fellow.
we were exchanging, and the idea here is we all know that if things can get resumed by May 1st, and that's a big if,
Yeah,
most dentists will not have a full schedule because most people will
yeah,
have to catch up on what's lost. So we know that in dental field, this is just the beginning of the bad news. But
yeah.
since we were talking about this is the best time for us to reinvent ourselves and maybe to rethink the way that we're practicing and also seeing our profession. We were saying that how about we give we talk about all dentists throughout the world, give the university a hand since you have students that can study but cannot graduate just for the fact that they haven't finished the quotas and the cases, and we have offices and some free time on our hand. Also, I spoke with another community leader, Dr. Eric Lacoste, and he said that he's more worried about the people he helps in philanthropy than what he's been losing, because I'll be fine, I'll get out of it. But since we're gonna have offices, and in Canada we're gonna have be subsidized to keep employees on a payroll, we're gonna have some free time. Then you should, I think, take care of the future. So, because other graduated this year, there's a whole promotion of graduate that needs some kind of help.
Yeah.
And if we can open our heart to say that, okay, for the time that I'm there, I know I won't make money, but instead of just wasting my time, I open my doors to those the most in need, or to those who have contributed the most to this crisis, just to say thank you. That might be not a solution, but I think some piece of the puzzle that start making sense. I'm just
I,
bringing out the idea, and
I
hopefully that will
completely.
make its way to the top.
No, I agree. I agree. I think that's a very good idea, and I think I've been looking at some of the websites. I've been looking at some of the work that people are doing, including yourself. I saw your video, and I absolutely loved it. People are trying to contribute to the best of their ability. We've been limited. The problem is, if you will, the problem with this particular virus is that the cure of this virus is in something which pretty much negatively affects a lot of other things which have already been not negatively affected. So, for example, when we say physical distance, that limits our capability to actually teach somebody the way we would want to. So, when we do the online lectures or webinars, whatnot, it does helps explain the concept, which is amazing, which is absolutely necessary. But the skill point, especially in the higher classes, is going to be more challenging. So it's a step in the right direction, but uh, and I think that's unfortunately that's probably one of the major things that we can do at this point in time. There's not much, unfortunately. When I was talking with a couple of dentists, not just a couple, I've read the a few threads as well. The common theme was a lot of dentists, a lot of specialists. They feel helpless in the sense that they want to help, they want to contribute, they feel that they come from the same fabric, they come from the same when it comes to being associated with you with the health, the medical profession, but they're not able to really contribute given the social distancing that is needed at this point in time. So webinars, online lectures, and everything. I think that's the best that we can do. Probably.
Third, Dr. Mo, I think that, and I said that on one of my videos, I think that right now, most of the population have been put on pause, and we have very good people fighting an invisible enemy at the front. But since we are here in the back, I think it's our duty to think ahead of what's coming. Since
I agree.
the rest of them are busy fighting for us, and that's why I'm raising those questions. That's also why you come and join us this early in the morning.
No, no, I appreciate. One thing I would like to add. I've been thinking about it, especially I was thinking about it last night. And what I'll try to do is to project or give false hopes. However, I would also like to look at what happened in the past. And if you look at in the past, for example, if you look at the recession in 2008-9, which wasn't fun time, from a dentist's point of view, it was not as bad as compared to, let's say, a lot of other business. So I feel it's not the best. And like we touched this aspect that, even if we start in May, June, or July, we don't expect to run full schedules. But still, I think generally, for majority of us, we are still more blessed to be in a position that it's much, much, much better than most people. So, and the other thing is, if you look at, for example, just if I could touch briefly, um, the other thing with dentistry is, God forbid, I feel bad for small businesses. If you think about it, if you go to a restaurant, you get a meal, or you're an Uber driver, or you're a taxi driver, if that meal is not served or that ride is not taken, the revenue is pretty much lost. And in dentistry, if the filling is not done or the wisdom tooth is not being taken, that still needs to be taken out, or the filling still needs to be done. So it's a delayed thing rather than a completely lost opportunity of work. So in that regard, it's not as bad as it could be or would be in a lot of other businesses. That's why I feel more for them compared to, let's say, dentists.
Based on the people, and I'll take just a minute to talk about. Based on the minute that I've changed with, and I've been had the fortune to talk with a lot of very smart thinker. Dentistry will never be the same because after this, we're gonna have to upgrade most of our offices to comply to the new regulation. Aerosol and everything else is going to be much more expensive to practice, and our fees are already through the roof if we listen to our patients. And we are small businesses. They're thinking that 25% of small business might disappear after this crisis. Our industry in Canada, it's made of about 85% of small businesses. So the crisis is throughout the board. And you mentioned recession. It's the first time that we have a worldwide recession touching everybody all at once.
That's true.
Usually, it's
That's
yeah,
true.
you have some time to act. Now all we have is a month to think, and that will be it.
That's That's true. And the problem is that is true. If you really think about it, the worrisome thing is right now we are focused, almost everybody. When I see we are focused, that means pretty much globally. Everybody is focusing on trying to save lives, which is the most important thing. It's true. However, so we are as a community, as people, we are in survival mode. But hopefully, God willing, all goes well when things become more stable. Let's say 3, 4 months down the road, and we have passed, the curve is flattened, people are happy that, okay, thank God it's done. At that stage, the curve of the pandemic, let's say it's flattened, the economic curve, the problem with the economy would start to rise because there would be accumulation of debt, accumulation of payments that would need to be done. And the government, if you look at, for example, Canada, just a few days ago, there were about over 2 million uh, people had filed for employment insurance. And if the government is trying to do the best that they can. But if they're going to pay $2,000 per person, the number is just staggering. So if you calculate things, it goes to about $2 billion, roughly around there per month or something like that, which is insane. Meaning in the next coming months, it's going to be very challenging from an economic standpoint. Right now, we are in a health crisis. The economy is important, but in the next few months, the economic problem may become a giant once we realize that health has been sort of taken care of.
Dr. Mo, we are running out of time. If I'm asking you within a minute to give us a message of hope to close this, what would that be?
The good thing is, if you look at the population in general, regardless if it's US, it's Canada, it's China, people in the world have come together. We are faced with a problem which is causing havoc at a global level, which has made all the nations come together, which is amazing. It's unprecedented. So, although we are in a situation which is very dire, which is not good, and it's unprecedented, but similarly, the response has also been amazing. I was amazed by, for example, people of Alberta. The economy has been hit back like probably never before, and yet the medical people told the people of Alberta that we supplies because the Albertans came and they just packed things up, and they, despite not having a lot at home, they were sharing. So this is amazing. The good side of humanity has shown up, which is awesome. And if we stick together, I think it's just another crisis. People, when they came together, they were able to overcome the Spanish flu, and they were able to overcome pretty much other problems in the past. And I think if we come together, pretty much overcome this one.
The wisdom of Dr. Javaid. Keep your mind, keep your heart open, and that would just be another crisis. Dr. Javid, thank you so much for taking the time.
Pleasure is mine.
Keep your hopes up, keep your positivity up, and I think that this would just be another crisis.
I am super grateful, and I hope, wish, and pray that's what we get, not more than that.
Thank you so much.